Thank you, Jacques, for your kind presentation, and thank you, Dan and Tamir, for inviting me to be here today. It's a great honor. As Jacques told before, my talk will be about the opportunistic salpingectomy for tubal endometriosis. Then you have my disclosures, and my job of this today will be to describe the incidence and what is tubal endometriosis, and mainly the consequence of tubal endometriosis. We will discuss also the role of the fallopian tube endometriosis in the origin of ovarian endometriosis and ovarian cancer, and also to discuss the potential effects of the salpingectomy, of opportunistic salpingectomy in ovarian reserve and early menopause, and also to analyze the benefits of a systematic incorporation of this technique, the salpingectomy, in our daily practice. You know that tubal endometriosis is the involvement of the tubes in endometriosis cases. Classically, you know that the incidence of endometriosis in the tube has been stated to be between 4 and 10% of the cases. But during the last 4 or 5 years, there have been several papers focusing on this topic, and those papers clearly show that the real incidence of tubal endometriosis is much bigger than previously suspected and previously described. You know that when you look at the microscopic disease, the incidence can be as high as 40, even more % of the cases of tubal endometriosis, and the consequences of this involvement of the tubes can have several phases. First, for sure, fertility is the main I don't know. I don't know the connection of this screen is something, but no, it's okay. No, that the screen is working.
I know. It's going back.
Yeah,
and forth.
okay.
I'm not sure what it
No,
is.
don't worry. So the fertility is the main problem. For sure, the function of the tube can be affected by the endometriosis. Even the cellular function of the tubes can be affected by endometriosis. But not only fertility, also pain can be an important problem in patients with tubal endometriosis. You know that all the inflammation. You know that there are several mechanisms of pain in patients with endometriosis. The local inflammation, neurogenital inflammation, peripheral sensitization, central sensitization, and other factors. A lot of factors may influence can be the cause of the pain in patients with endometriosis, but we don't know which role may play exactly the involvement of the tubes in patients with endometriosis. And we need, sure, further studies to evaluate, to have a proper evaluation of the role of the tube and the role of the salpingectomy in treating patients with the pain of patients with endometriosis. We know also that the tubal endometriosis has other implications. For example, this group coming from Arizona and from China, they clearly show that the possible relationships between tubal endometriosis and ovarian endometriosis, and also the possible relationship between tubal endometriosis and endometriosis-related cancers in the ovary. Now we are at an important point in this talk, that it is ovarian cancer. Ovarian cancer, you know, it is it's the first cause of death in women from gynecological malignancies. There are 20,000 new cases of cancer in the States, 2,000, more than 2,500 in Spain every year, and the mortality is so high because we arrive to diagnose in a very advanced stages frequently because there are no means of screening. You know that there are two different types of ovarian cancer, type 1 and type 2. Probably the type 1 is related with endometriosis and it can be, we must keep it in mind. But the type 2, that it is the most frequent type of cancer in which the high-grade serous carcinoma is clearly pertains to this type and is related with the P53 mutations. You know that the fallopian tube is thought to be the origin of this cancer. The stick, the serous tubal intraepithelial carcinoma cells may go into the body and be the origin, as stated by 100 years ago by Sampson, that we have been already told this morning, but we now we have the scientific security that this is the real origin of the cancer. You know that all the research done in the last years, from the 2000, about the origin of cancer in patients with BRCA mutations, bring us to the certainty that is in type 2 tumors, in type 2 ovarian cancer, is the stick, are the origin. And it gives us the opportunity to change our paradigm. You know that hysterectomy is one of the most frequent surgeries performed in women. A lot of times indication of hysterectomy is endometriosis, and we are endometriosis surgeons and we have a responsibility on this field. And you know that maybe we have now the opportunity to make a significant risk reduction of ovarian cancer that probably will bring us to a new era in this disease. You know that there are no differences in if we perform the opportunistic salpingectomy in those patients. No difference in risk of surgical complications, not hospital admissions rates are higher, the hospital stays the same, and the surgical time is not influenced by the opportunistic salpingectomy. And we need to know, however, what is the impact of the salpingectomy, of the opportunistic salpingectomy in ovarian reserve, in the onset of the menopause, if it has a real impact on ovarian cancer mortality and the healthcare cost. And we can also ask if this procedure can be easily adopted by the gynecologists and other specialists. You know that there are several studies looking at the effect of the salpingectomy in ovarian reserve. In this paper published some years ago, you can see it was a randomized trial, including patients scheduled for hysterectomy for benign conditions, and then they perform anti-mullerian hormones 3 months prior to the surgery and 3 months after. And you can see here how there were no differences in the levels of anti-mullerian hormone in any case. The same in this other, I don't know, but something happened.
It's connection problem, I believe.
No, but you know,
the other one is working.
it is working.
Yeah, it's like this. It's interesting, man.
No, it should be okay, because if not.
Yeah. This one is like, it's creating the problem.
Okay, you maybe you can try to see the other, or not. Okay, this something is wrong, but okay, in this paper again, they perform a prospective evaluation of the effect of hysterectomy in the, now is the other one, in the hormonal levels of the patient submitted to hysterectomy, and you can see exactly the same than before. There was not differences in, not at the 3 and 9 months after surgery in patients regarding their hormonal levels. The same happens with the menopause onset. In this paper, I think it is a very interesting paper. It was a retrospective population-based study, a cohort study from Scandinavia. You know that they have probably the biggest databases all over the world, and they included more than 40,000 patients with previously performed hysterectomy, opportunistic salpingectomy, or hysterectomy plus bilateral salpingo-forectomy. And when they look at in which moment the patients go to the doctor to ask to referring menopausal symptoms or asking for menopausal treatment, you can see here how the patients with opportunistic salpingectomy has no differences with the patients with only hysterectomy, showing that the problem is when you take out the ovaries, for sure. So, regarding the two, all the papers I have shown you, if the opportunistic salpingectomy affects the ovarian blood supply, it is not enough, it is not substantial enough to result in ovarian reserve diminution or the early onset of the menopause. And the most important thing is that we have the opportunity to reduce the ovarian cancer. The ovarian cancer, which is one of the most lethal cancers for women. In this study, it was a retrospective study, a case control study in Sweden. They include women with epithelial ovarian cancer, fallopian tube or peritoneal cancer, and then they include also 10 controls per case, and look at the previous exposures to salpingectomy, hysterectomy, or tubal ligation. There were included more than 4,000 cases and more than 45,000 cases. And look, the results are very clear. When you perform salpingectomy, mainly bilateral salpingectomy, although the hysterectomy may have a certain protective effect, when you perform salpingectomy, the number of cases with cancer is clearly lowered, especially the type 2 cancer, that is the most serious one. It is another interesting study coming from the States. It was just a study of calculation of the impact of opportunistic salpingectomy in the mortality of ovarian cancer. The authors they know the rates of hysterectomy, the rates of tubal ligation, ovarian cancer, and they try to construct a model to evaluate the cost effectiveness of the opportunistic salpingectomy and the impact of this procedure in the incidence of ovarian cancer, including the cost of preventing any case of cancer and the number of lives that can be saved. You can see here that the results are very clear. With the hysterectomy, the risk of ovarian cancer is a little bit smaller, but when you perform bilateral salpingectomy, the relative risk is decreased by to a 30%. And you can see here that the extra cost of performing the opportunistic salpingectomy is just $400 in the cases of when you were performing a tubal ligation, and when the scheduled surgery was hysterectomy, the extra cost is only $124. And taking in mind that the ovarian cancer cost is more than $65,000 at the first year, then is almost $5,000 per year during the life of the woman, and the last year when she is going to die, the cost is again $64,000. That's last year. You can save almost $400 million per year, and the most important thing is you can save almost 2,000 lives, 2,000 new cases per year if you adopt this kind of policy of opportunistic salpingectomy. For sure, it can be easily adopted by the gynecologists. This study performed just very fast after very soon after the paper by Carmona. You can see how most of the gynecologists in this country were performing. 60% of them were performing opportunistic salpingectomy when they are going, where they are performing benign surgery for benign procedures. In conclusion, there is a clear role of the fallopian tube in the development of ovarian cancer, and even the development of endometriosis, of ovarian endometriosis. There is opportunistic salpingectomy is a safe procedure that may decrease the risk of ovarian cancer and has no effect on any detrimental effect on menopause or ovarian reserve. And we should counsel our women about the opportunistic salpingectomy. For sure, when it is performed for industrial, I think there is no discussion. But we can discuss today what about when we are performing surgery for endometriosis in patients with not more pregnancy decide, and we can try to discuss. And for sure, we should try to convince our colleagues from other specialties, not only gynecologists, general surgeons, urologists, when they bring to the ward a patient with no more reproductive desire, to perform not only for gynecological surgery, for all the surgeries, for all the surgeries to perform a bilateral salpingectomy can be an opportunity to decrease the mortality of the ovarian cancer. And just to finish, to invite you to the next Congress of the SEUT that will be in Prague in next April next year. Thank you very much for your attention, and sorry for all the technical inconvenience.